Today we will start with the chapter 45, which is named Physiology of Deep Sea Diving and the Physiology of Other Hyperbaric Conditions. Diving presents a number of challenges to the respiratory system, and these challenges they are associated with the external hydrostatic pressure at increased depth. You also know that water is denser than air, so the pressure rises quickly with depth beneath the surface. Wondering how much pressure? Well, it takes a water column of only 10 meters to exert a pressure equivalent to that of the atmosphere, and that is 760 millimeter of mercury. So, when human beings descend beneath the sea, pressure around them increases greatly, and water squeezes and compresses a diver from all the sides. Then it also compresses the gases within the alveoli, which increases the partial pressure, driving uptake of all the gases and decreased alveolar volume. In other words, you can say that the challenges of the deep sea they can be summarized under these two headings. By looking at this chart, you can understand that as the person descends into sea, the pressure increases and the gases are compressed to smaller volumes. Now look at this figure to understand how oxygenation could work in deep sea. So to keep the lungs from collapsing, air must be supplied at very high pressure to keep them inflated. But this thing exposes the blood in the lungs also to extremely high alveolar gas pressure. And it's a condition which is called hyperbarism. Don't forget that beyond certain limits, these high pressures can cause great alterations in body's physiology, and they can be lethal. Okay, now let's have a look at those effects of high partial pressures, one of which is nitrogen narcosis. You see, when a diver remains beneath the sea for an hour or more and he is breathing compressed air, the depth at which the first symptoms of the mild narcosis appear is about 120 feet. At this point, the diver begins to exhibit cheerfulness and he or she loses many of his or her worries or cares. Now at 150 to 200 feet, the diver starts becoming drowsy. And at 200 to 250 feet, his or her strength decreases significantly, and the diver often becomes too clumsy to perform the work required. And beyond 250 feet at a pressure of about 8.5 atmosphere, the diver usually becomes almost useless if he remains at this depth too long. You can see that these effects are similar to those of the alcohol intoxication. And for this reason, it has been called raptures of the depth. Actually, what happens is that nitrogen dissolves in the fatty substances in neuronal membranes. And because of nitrogen's physical effect on altering the ionic conductance through membranes, it reduces the neuronal excitability. Here, guys, look at this figure to understand oxygen toxicity. You should know that extremely high partial pressure of oxygen that occurs when oxygen is breathed at very high alveolar oxygen pressure, it can be harmful to many of body's tissues. For example, breathing oxygen at 4 atmospheric pressure of oxygen, where the partial pressure of the oxygen that will be around uh, 3000, even more than 3000 millimeters of mercury. Now, this kind of breathing, this will cause brain seizures followed by coma in most people within 30 to 60 minutes. And these seizures, they often occur without warning, and they are likely to be deadly to the divers submerged beneath sea. So, if you want to list the effects of acute oxygen poisoning, these include nausea, muscle twitchings, dizziness, disturbances of vision, irritability, and also disorientation. Now, the interesting thing is that exercise, or you can say activity, it greatly increases the diver's susceptibility to oxygen toxicity because it causes these symptoms to appear much earlier and with far greater severity than in a resting person. Since I mentioned oxygen poisoning, here I wouldn't forget to tell you about the effects of oxidizing free radicals. These free radicals actually are superoxide free radical oxygen, and the peroxide radical is in the form of hydrogen peroxide. Mm, Now, take note that even when the tissue's partial pressure of oxygen is normal, uh, means it is at level of 40 millimeter of mercury, small amounts of free radicals are still continually being formed from dissolved molecular oxygen. But fortunately, our tissues contain multiple enzymes that rapidly remove these free radicals. Examples of these are peroxidases, Catalases, and superoxide dismutases. Therefore, as long as the hemoglobin oxygen buffering mechanism maintains a normal tissue partial pressure of oxygen, the oxidizing free radicals they are removed rapidly enough that they have little or no effect in tissues. But then above critical alveolar partial pressure of oxygen, say about 2 atmospheric, the hemoglobin oxygen buffering mechanism it fails. Tissues partial pressure of oxygen it can then rise to hundreds or thousands of millimeter mercury. So at these high levels, amount of oxidizing free radicals overloads the enzyme system, which was designed to remove them. And now they can have serious destructive and lethal effects on cells. One of the principal effects is to oxidize polyunsaturated fatty acids that are essential component of many cell membranes. Still another effect is to oxidize some of the cellular enzymes and thus damaging severely the cellular metabolic systems. Don't forget that nervous tissues are especially susceptible because of their high lipid content. And most acute lethal effects of acute oxygen toxicity, they are caused by brain dysfunction, the chronic poisoning, right? Even after about 12 hours of only one atmospheric oxygen exposure, means 760 millimeter of mercury partial pressure of oxygen, the lung passageways, they show congestion, pulmonary edema, and atelectasis. Wonder why? Because this much pressure, it damages the lining of bronchi and alveoli. This damage begins to develop even at this pressure when given chronically. Mm. Although the air spaces of the lungs, they are directly exposed to high oxygen pressure. But even at this level, oxygen is delivered to other body tissues at almost normal partial pressure of oxygen because of the hemoglobin oxygen buffer system. Now, there is a bit of good news that the diver has no problem due to carbon dioxide toxicity because depth alone, it does not increase carbon dioxide partial pressure in the alveoli. As depth does not increase the rate of carbon dioxide production in body, and as long as the driver continues to breathe a normal tidal volume and expires carbon dioxide as it is formed, the alveolar partial pressure of carbon dioxide, it will be maintained at normal value. So where comes the carbon dioxide toxicity? You see, in some types of rebreathing apparatuses, carbon dioxide, it can build up in the dead space air of the apparatus, and it can be rebreathed by the driver. Up to an alveolar carbon dioxide pressure of about 80 millimeter mercury, which is twice that in normal alveoli. The diver usually tolerates this buildup by increasing minute respiratory volume to a maximum of 8 to 11 folds to compensate for the increased carbon dioxide. But when it gets beyond 80 millimeter mercury alveolar partial pressure of the carbon dioxide, the situation, it becomes intolerable, and eventually the respiratory center, it begins to be depressed rather than excited. Do you know the reason? Because it gets depressed because of the negative tissue metabolic effects of high partial pressure of carbon dioxide. Now, in this situation, diver's respiration, it begins to fail rather than to compensate. And in addition, the diver develops severe respiratory acidosis and varying degree of lethargy, and it progressed to narcosis and finally even anesthesia. Now, this is the main culprit. When a person breathes air under high pressure for long time, amount of nitrogen dissolved in the body fluids increases. Similarly, blood flowing through pulmonary capillaries becomes saturated with nitrogen to same high pressure as that in the alveolar breathing mixture. And over several more hours, enough nitrogen is carried to all the tissues of body to raise their partial pressure of nitrogen also to the equal of the nitrogen in the breathing air. Do you wonder what's the harm of this nitrogen? You should know that nitrogen is not metabolized by body, so it remains dissolved in all the body tissues. Now, until the nitrogen pressure in lungs is decreased back to some lower level, and at that time the nitrogen can be removed by reverse respiratory process. But this removal, it often takes hours to occur. And this removal is the source of multiple problems which are collectively called decompression sickness. We will get to it, but first focus on the nitrogen dynamics. At sea level, almost exactly 1 liter of nitrogen is dissolved in the entire body. Less than half of this is dissolved in the water of the body, and more than half in the fat of the body, because nitrogen is 5 times as soluble in fat as in water. Uh, Now, just to know how much a diver has become saturated with nitrogen, look at this sea level volume of nitrogen dissolved in the body at different depths. Let me tell you some nitrogen facts. Number one, the several hours they are required for the gas pressure of nitrogen in all body tissues to come nearly to equilibrium with gas pressure of nitrogen in alveoli. Because blood does not flow rapidly enough, and nitrogen also does not diffuse rapidly enough to cause rapid equilibrium. Here, the nitrogen dissolved in the body water, it comes to almost complete equilibrium in less than 1 hour. But fat tissue, it reaches the equilibrium only after several hours, because it requires 5 times as much transport of nitrogen, and plus it has a relatively poor blood supply. But here, don't forget the crucial factor of time. If a person remains at deep levels for only a few minutes, not much nitrogen dissolves in body fluids and tissues. But if a person remains for several hours, both the body water and the body fat, it becomes saturated with nitrogen. Here comes the famous decompression sickness. Now, this could be your university question, and it may be termed with the different names which are mentioned on the screen. You see, if a diver has been beneath the sea long enough that large amounts of nitrogen have dissolved in his or her body, and the diver then suddenly comes back to the surface of sea, a minor or serious damage may be caused in almost any area of the body, and this is called decompression sickness. I'm hoping that you can understand the mechanism behind it. Look, a diver breathing air at pressure for prolonged periods can accumulate significant amounts of nitrogen within his tissues. You already know that the average amount of nitrogen contained within the body at sea level is around 1 liter. So a prolonged dive at 30 meter raises this amount to as much as 4 liters. Now this nitrogen is taken up by diffusion across the blood gas interface, and then it is distributed by the circulation to all tissues, but it preferentially partitions in body fat. Now look here. When a diver ascends back to the surface, nitrogen is no longer subject to pressure that forced it to dissolve at depth. So it comes out of solution and forms pure nitrogen bubbles. During this sudden low pressure, significant quantities of nitrogen bubbles they can develop in body fluids, either intracellularly or extracellularly, and they can cause damage in the body. So, how does the sickness presents? These symptoms are pain in the joints and muscles of legs and arms, and it affects 80 to 90% of those persons who develop decompression sickness. More severe symptoms may include neurologic deficits, dyspnea, or even death. Keep in mind that in 5 to 10% of people with decompression sickness, nervous system symptoms also occur. So, how would you explain these symptoms? Now, listen carefully. Depending on the number and the size of the bubbles formed, the gas bubbles they block many blood vessels in different tissues. At first, only the smallest vessels are blocked by minute bubbles, but as the bubbles they join, progressively larger vessels are affected. So the tissue ischemia and sometimes tissue death are the result. And it is the ischemia which typically manifests as pain in joints and in limb musculature. As I already mentioned, the central nervous system symptoms they range from dizziness in about 5% to paralysis or collapse and unconsciousness in as many as 3%. This paralysis may be temporary, but in some instances the damage is permanent. About 2% of people develop the chokes caused by a massive number of microbubbles plugging the capillaries of the lungs. And this is characterized by serious shortness of breath, often followed by severe pulmonary edema and occasionally death. Now, the solution lies in nitrogen elimination by a slow decompression. You see, if a diver is brought to surface slowly, dissolved nitrogen can usually be eliminated by expiration through the lungs to prevent decompression sickness. So how does this slow decompression works? Actually, slowing the rate of ascent, it gives the excess gas which was dissolved in aqueous phase. It gives this gas more time to diffuse out of the tissues and into the circulation for the transport to lungs for exhalation. Uh, let's look at the rate which is usually optimal for this kind of slow decompression. You see, about two-thirds of total nitrogen is liberated in 1 hour, and about 90% in another 6 hours. But more time is required for obese people because fat is relatively avascular. This increases the distance over which the nitrogen must diffuse before it can be carried away by circulation, thereby slowing the rate at which it can be removed. Anyway, the decompression tables, they have been prepared by the US Navy that detail procedures for safe decompression. For example, a diver who has been breathing air and has been on the sea bottom for 60 minutes at a depth of 190 feet is decompressed according to the schedule, which you can see here on the screen. So you can see that for a work period on the sea bottom of only 1 hour, the total time for decompression, that is about 3 hours. Now, here is another strategy. It is to put the diver into a pressurized tank and then to lower the pressure gradually back to normal atmospheric pressure using essentially the same time schedule. This tank decompression is even more important for treating people in whom the symptoms of decompression sickness develop minutes or even hours after they have returned to the surface. In this case, the diver is recompressed immediately to a deep level, and then decompression is carried out over a longer period than the usual decompression period. Here I don't want to skip the mention of hyperbaric oxygen therapy. In this, the oxygen is usually administered at the partial pressure of 2 or 3 atmosphere through a mask or intratracheal tube. The same oxidizing free radicals which were responsible for oxygen toxicity, they are also responsible for some of the therapeutic benefits in conditions like this decompression sickness. Other than that, the therapy could be tried in arterial gas embolism, carbon monoxide poisoning, osteomyelitis, or even myocardial infarction. Practically, the most successful use of hyperbaric oxygen, it has been for the treatment of gas gangrene, as the bacteria that cause this condition, clostridial organisms, they grow best under anaerobic conditions, and they stop growing at oxygen pressure greater than 70 millimeter of mercury. Hyperbaric oxygenation of tissues can frequently stop the infectious process entirely, and thus it converts a condition that formerly was almost 100% fatal into one that can be cured in most instances by early treatment with hyperbaric therapy. Now, this is an interesting kind of diving. What happens is that when divers must work at very deep levels, between 250 to 1000 feet, they frequently live in a large compression tank for days or weeks at a time. It means that they remain compressed at a pressure level near that at which they will be working. This keeps the tissue and the fluids of the body saturated with the gases to which they will be exposed while diving. Then when they return to the same tank after working, there are no significant changes in pressure, means no decompression bubbles are formed. To make the saturation diving more effective, during this kind of diving, helium is usually used in gas mixture instead of nitrogen, and now the mixture is called Heliox. Now there are reasons for preferring helium over nitrogen, which I'm going to list. So write down if you like. Number one, it has only about 1/5 the narcotic effect of nitrogen. Then only about 1/2 as much volume of helium dissolves in body tissues as nitrogen. And the volume that does dissolve, it diffuses out of tissue during decompression several times as rapidly as does nitrogen. Last but not the least, helium has got 1/7 the density of nitrogen. This low density of helium, it keeps the airway resistance for breathing at a minimum. And it is very important because highly compressed nitrogen is so dense that airway resistance, it can become extreme, sometimes making the work of breathing even beyond limit. So you can see that Heliox is quite a hero. It can also be used clinically to support patients with anatomic and physiologic airway obstruction. Because the gas mix decreased density, it allows it to slip past the obstruction site more easily than does atmospheric air, and this is how it helps improve patients' oxygenation. Another thing which you should not forget is that in very deep dives, it is important to reduce the oxygen concentration in the gaseous mixture because otherwise oxygen toxicity would result. For example, at a depth of 700 feet and at an atmospheric pressure of 22, only 1% oxygen mixture will provide all the oxygen which is required by diver. Uh, Whereas a 21% mixture of oxygen, which is its normal concentration in the air, it delivers a partial pressure of oxygen to lungs of more than 4 atmosphere, which is a level very likely to cause seizures in as early as 30 minutes. Now the discussion of underwater workers, it makes me think of the submarines also. And we should salute our Navy soldiers as the internal environment of a submarine is anything but pleasant. And furthermore, in atomic submarines, there exists the problem of radiation hazards. Well, luckily, with the appropriate shielding, amount of the radiation received by crew submerged beneath the sea, it has been less than normal, which is normally received above the surface of the sea from the cosmic rays. But then the poisonous gases on occasion, they can escape into the atmosphere of submarine, and they must be controlled rapidly. Then during several weeks immersions, cigarette smoking by the crew, it can liberate enough carbon monoxide that if not removed rapidly, it can cause carbon monoxide poisoning. Even freon gas, it has been found to diffuse out of refrigeration systems in the sufficient quantity to cause toxicity. Well, you have to be fond of war movies to know that if a submarine is hit by a torpedo, sometimes the submariners, they get lucky to have an escape chance. This escape is possible from as deep as 300 feet without using any apparatus. Proper use of rebreathing devices, especially when using helium, that can allow the escape from as deep as 600 feet or even more. However, one of major problems of the escape, that is the prevention of air embolism. As the person ascends, the gases in the lungs they expand and sometimes they rupture a pulmonary blood vessel, forcing the gases to enter the vessel and cause air embolism of circulation. Therefore, as the person ascends, he must make a special effort to exhale continually. Now, some of you might have enjoyed scuba diving but still don't know what the word scuba means. Well, it's a self contained underwater breathing apparatus. It consists of one or more tanks of compressed air or some other breathing mixture. Then there is a first stage reducing valve for reducing the very high pressure from the tanks to a low pressure level. Talking of the valves, there is a combination inhalation demand valve and also exhalation valve that allow air to be pulled into the lungs with slight negative pressure of breathing and then to be exhaled into the sea at a pressure level slightly positive to the surrounding water pressure. And then, of course, there is a mask and a tube system with the small dead space. So, how does this scuba works? The first stage reducing valve reduces the pressure from the tank so that the air delivered to the mask it has a pressure only a few millimeter mercury greater than the surrounding water pressure. Also, the breathing mixture it does not flow continually into the mask. Instead, with each inspiration, slight extra negative pressure in demand valve of mask it pulls the diaphragm of the valve open and then automatically it releases air from tank into the mask and lungs. In this way, only the amount of the air needed for inhalation enters the mask. Then on expiration, the air it cannot go back into the tank but expired into sea. So this simple it is. Well, maybe I make it look so simple, but there are certain limitations also. Most important problem in use of scuba is limited amount of time one can remain beneath the sea surface. For example, only a few minutes are possible at 200 feet depth. And then tremendous airflow from the tanks that is required to wash the carbon dioxide out of lungs. So you see, greater the depth, greater the airflow in terms of quantity of air per minute that is required because the volumes they have been compressed to the small sizes. So